Weird. My vision is getting blurred. I'm kind of feeling warm. I'll schedule an appointment with my doctor soon if I don't feel better.
Good morning. How are you doing?
Hello, I'm feeling a little off, but I am ready for my appointment with my hygienist.
Please wait in the waiting area and our hygienist will call you in.
Thank you.
Hi, Minju. How are you? Oh, wow. Your due date is so soon.
Hey, Yasmin. Yeah, I can't believe it. It's been almost 9 months.
That's amazing. I got an environmental heat warning on my weather app this morning, and the AC in the building has been turning on and off.
Oh, yeah. My bus coming here had no AC and it was a bit busy. Hopefully it stays cool in here.
You can go ahead and take a seat in the waiting room. Your hygienist will call you in.
Thanks, Yasmin.
Minju?
Kelly. Hi, Kelly. You can come in for your cleaning now.
I can't believe my sister's here. I haven't seen her in a long time.
Good morning. How are you today?
Hey, I've been feeling so tired lately and I am late for my cleaning appointment.
No worries. You can go ahead and take a seat, and your hygienist will call you in.
Okay.
Hajin?
Minju?
Hi, Hajin. You can come in for your cleaning now.
Both of my sisters are here. I can't help but notice if Hajin's in weight loss. I hope she's okay.
Hey, Minju. You can follow me inside. How are you today, Kelly? It has been a little over 6 months since your last appointment. Any new health concerns or dental pain?
Well, I've been feeling a little nauseous since earlier, and I feel a bit bad, like I'm gonna faint. Maybe it's from how hot it is outside.
Were you able to have breakfast before your appointment?
No, I didn't eat breakfast.
Okay, I'm going to take your vitals now. Your blood pressure is stable and your heart rate is a bit high. Let's wait 5 minutes to take your vitals again.
5 minutes later.
Your blood pressure and heart rate has decreased to 90/60. It seems like you are showing signs of presyncope. When a patient shows signs of presyncope, dental procedures must be stopped. Presyncope signs and symptoms are noted. Place patient into a supine position with legs slightly elevated.
After positioning the client, circulation, airway, and breathing can be assessed since the patient is still conscious in the presyncope period. Oxygen or an ammonia ampule may be administered to help speed recovery. The planned dental treatment may be resumed if doubtful. Rescheduling is ideal.
When a patient loses consciousness, these are the steps to manage syncope. Step 1. Assessment of consciousness. Check if there is a response to sensory stimulation. Step 2. Activation of the dental office emergency system. Step 3. Place patient in the supine position. Step 4. Continue with basic life support as needed. The head tilt chin lift procedure and the carotid pulse is palpated to assess.
Step 5 is definitive care, administration of oxygen at any time during the episode, and monitoring of vital signs. Additional procedures include loosening of binding clothes, respiratory stimuli, for example, of a cold towel on the forehead.
If bradycardia exists, administer an anticholinergic. Delayed recovery occurs when the patient is not regaining consciousness after the previous steps or does not recover in 15 to 20 minutes. Possible causes are seizure, stroke, and hypoglycemia. It is important to activate EMS system and provide basic life support until arrival of the EMS team.
To safely manage post-syncope, it is important to determine the primary precipitating event and other factors, arranging for an adult to help escort the patient. It is also important to understand the drugs used for management, and that medical assistance is essential in case of delayed recovery.
Hi Minju, how are you doing today? It's been a little over 6 months since your last appointment. Any new health concerns or dental pain?
No dental concerns, but I've been feeling dizzy right after getting up and more nauseous, but that could be because of my pregnancy.
Oh, are you currently taking any drugs or medication? Postural hypotension is a common side effect of many drugs.
I am taking prenatal medication under my OB recommendation.
Well, now I'm going to take your vitals. Your heart rate is at 90 beats per minute and your blood pressure is a bit low at 100/70. Let's wait 5 minutes to take your vitals again. Your heart rate is at 100 beats per minute and your blood pressure has decreased to 80/60. It seems like you're showing signs of postural hypotension. Predisposing factors of hypotension are medication, reclining for too long, late-stage pregnancy, venous defects in legs, heat exposure, physical extreme tiredness, and starvation. And it is also associated with other chronic diseases.
When a patient shows the signs of posture hypertension, step 1 is to assess consciousness of patient. Step 2 is activating the dental office emergency system.
Step 3, place patient in a supine position with slightly elevated legs. Step 4, after positioning client, circulation, airway, and breathing must be assessed.
Step 5 is definitive care, which includes administration of oxygen at any time during or after the episode and monitoring vital signs.
Step 6, positioning client from a supine to upright slowly. However, activation of EMS must occur if the episodes continue.
Step 7, if patient's vital signs return to approximately baseline levels and the ability to walk freely without clinical signs and symptoms of hypertension, patient may be discharged.
How are you today, Hawajin? It has been a while since your last appointment. Any new health concerns or dental pain?
No dental concern, but my skin color changed recently, and I have changed my eating routine and lost some weight. However, I'm craving for some salty food, and I've been feeling overall tired, like I don't want to do anything too.
Okay, I'm gonna take your vitals. Your heart rate is 90 beats per minute and your blood pressure is a bit low at 110/70. Let's wait 5 minutes to take your vitals again. Until then, I can check your glucose levels. Your blood pressure has decreased to 106/68. Your glucose level is at 3.8. It seems like you're showing signs of acute adrenal insufficiency. These are the steps to manage a conscious patient showing signs and symptoms of acute adrenal insufficiency.
Step 1, termination of dental treatment. Step 2, position the client in a supine position with slightly elevated legs.
Step 3, after positioning client, circulation, airway, and breathing must be assessed. Step 4, definitive care, which includes monitoring vital signs, blood pressure and heart rate recorded in 5-minute intervals throughout the episode. It is also important to seek for emergency medical assistance at this stage and transport client to emergency department of a hospital if needed.
Step 5, additional management for the conscious client. The administration of BLS as needed. Obtaining an emergency kit and providing oxygen via a full face mask or nasal hood as a flow, and administration of glucocorticosteroids to stabilize the client.
These are the steps to safely manage an unconscious patient showing signs and symptoms of acute adrenal insufficiency. Step 1, recognition of unconsciousness. Step 2, place patient in the supine position with legs slightly elevated. Step 3, after positioning client, circulation, airway, and breathing must be assessed. Step 4, definitive care, which includes emergency drugs and oxygen. It is also important to seek for emergency medical assistance at this stage. Evaluation of medical history during this stage and continue basic life support until the arrival of EMS if the cause is not obvious. If glucocorticosteroids insufficiency is the cause, administer 100 milligrams hydrocortisone via IV for 30 seconds. If hypotension is present, additional drug therapy is essential. Step 5, transfer unconscious patient to the hospital. All 3 sisters were given medical clearances to continue their next dental appointment safely. Kelly, Minju, and Hwajin rekindled their sister bond after their dental appointments and have moved on from their past issues. Minju gave birth to a healthy baby and named her Abby Sherry.